Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org. Idaho lost more than 2,000 farms over a 5-year period. Idaho Matters wants to know how that's impacting farmers, cities, and counties. Listen to our series on farming called Land and Legacy. Episodes available on Monday afternoons through November 17th in the Idaho Matters podcast feed. From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. In the wake of the U.S. Supreme Court's 2022 decision to overturn Roe v. Wade, Idaho's strict abortion trigger law took effect, allowing abortion in only cases where the mother's life is at risk or in instances of rape or incest with a documented police report. Well, now, a recent study published in the Journal of the American Medical Association has found a dramatic shift in our state's medical landscape. Between August of 2022 to December of 2024, Idaho lost 35% of its OBGYN physicians who practiced obstetrics. That's nearly 1 in 3 doctors who delivered babies, either leaving the state, retiring, or stopping obstetrics care altogether. And with Idaho already ranking among the lowest in the nation for OBGYNs per capita, this raises major concerns about access to maternity care, especially in the more rural areas of our state. So joining us now to talk about this issue more are Amber Nelson, Executive Director of the Idaho Coalition for Safe Healthcare, and McKay Cunningham, Graduate Professor and Director of Master of Applied Public Policy at the College of Idaho. We should say the Idaho Coalition for Safe Healthcare will be hosting a policy forum this evening that's focused on the disappearing doctors as well as safe healthcare in our state. I want to welcome both of you to the show.
Hi, Gemma.
Hi there. Great to be here.
Nice to have you both with us. And Amber, let me start the conversation with you. Your organization has been tracking the impact of Idaho's abortion laws on the medical community for some time now. So what was your reaction to the JAMA study showing that more than a third of our state's OBGYNs have actually stopped practicing obstetrics since 2022?
Well, I can tell you it was devastating, but not surprising. This is what happens when we take evidence-based healthcare and politicize it. So because of the laws that we have in the state currently, we've made healthcare access, which should not be controversial, a very controversial topic. We know that healthcare access is essential, but our laws are pushing out doctors, and the consequences are being felt across the state and now being demonstrated as in this report.
So, McKay, help us understand the policy side of this, if you could. What specific provisions in Idaho's post-obs law have made it difficult for physicians to continue practicing, and how do they differ from some laws maybe in some other states, just maybe even across the border from us?
Yeah, you bet. Idaho's law is one of, if not the most restrictive abortion law in the country. It has been termed a near total abortion ban, which means that any abortion in the state of Idaho is a crime, is a felony, except for a couple of very narrow exceptions. And the one that has garnered the most attention is the exception where abortion is permissible if it's, quote, necessary to prevent the death of the pregnant woman, end quote. And so medical experts across Idaho have articulated how difficult it is in practice to apply this medical exception, especially to high-risk pregnancies. There's just a lot of uncertainty about how the high risk of death, how high that risk of death needs to be, or how close to death the patient must be before being able to allow care in terminating that pregnancy. So you also asked about other potential policies, other laws across the United States. And after the dissolution of Roe, states had the authority to determine what kind of law each state wanted to pursue. And so there's a huge diversity of different approaches, some allowing abortion all the way up through fetal viability, some saying, okay, in the first trimester, it's perfectly legal, but afterwards it's not. Idaho's, again, is the most, or one of the most restrictive, and disallowing it at every time except for these very, very narrow exceptions.
So, Amber, the JAMA study pointed out that most OBGYNs who left Idaho, they either moved out of state or they just completely stopped delivering babies altogether. I am assuming you have had conversations with providers. What have they said are the biggest factors driving them to make those decisions?
It all comes down to the idea that medicine for so many of these practitioners is a calling. This is how they choose to spend their lives. And with our laws, they are being told that they get to choose now, not just to spend their lives helping others in the practice of medicine, but they now get to choose between practicing evidence-based medicine or following the law. So I can tell you, I spoke a while back with Amelia Huntsberger, who is an OBGYN who formerly practiced in Sandpoint. Her husband is an ER doctor, or was an ER doctor up in Sandpoint. And together they had to have a family conversation about what happens if and when we are found to be crossing the boundaries with what the current laws are. And as an ER doc, her husband obviously sees a lot of emergency room situations that could definitely include pregnancy complications. And as an OBGYN, that's what she does day in and day out. So together they had to have the hard conversation of, we have 3 kids. Who takes care of our children if one or both of us end up in prison or lose our licenses? And they made the decision to move out of state, and they are now happily both practicing medicine in Oregon.
Mm. So, McKay, from a governance and policy standpoint, did Idaho's lawmakers, in your opinion, anticipate really these kinds of consequences, like Amber just pointed out, for workforce retention? Really, when that trigger law, when that trigger law was written, because it was written way before, the Dobbs decision came out.
Yeah, great point. The trigger law was written before we would really see it come into play. And in fact, when it was written, I think a lot of politicians thought it would never come into play, that Roe versus Wade would not be summarily overturned on such short order. So I can't speak for what the legislators were thinking, but I can only guess that they did not have in mind a lot of these second negative consequences that have come with this legislation. The flip side to that, though, Gemma, is that it does not appear that our current legislature is willing to backtrack at all. There's been a lot of push from the medical community in particular to expand some of those exceptions, not to take the law away altogether, but to at least
Hmm.
expand some of those exceptions. And that has not been a piece of legislation that has moved forward. And so that's maybe why we're starting to see a little more support for that ballot initiative that addresses this very thing.
So, Amber, the study also found that 85% of Idaho's remaining OBGYNs are concentrated in only 7 counties. We have 44 counties in the state of Idaho. What does that mean in particular for families in the more rural parts of our state, both in terms of access, but also safety?
That's such a great question. So to continue that math problem a little more, I can share that what it means is that there are 23 OBGYNs to serve about 569,000 Idahoans across those 37 counties that aren't primarily urban. So what this means is that they have patients have longer drive times. And as we all know, in rural Idaho, when we hit the winter months, that can become not only prolonged drive times, but dangerous drive times. So those who have more complicated pregnancies, we've heard stories of them actually staying with family members that are nearer physicians or even staying out of state during the last little period of time, maybe the last couple of months of their pregnancies, because they're so concerned that they won't have access to the health care they need when it comes time to deliver. And we don't see any indication that this is going to turn around anytime soon. What we see right now is that doctors in this state are having a really hard time recruiting others to come work here. And we see that those who are working here, it's a challenge for them every day to get up and take care of their patients and balance that patient care and that calling to care for others with what is
Hmm.
in their own best interest as practicing physicians.
So, Amber, I want to go back to what you said about just the 23 OBGYNs
Yep.
who are supposed to be taking care of more than what, 500,000 individuals. Um, how is that even possible? Right? I mean, I'm thinking about, I mean, I've had 2 pregnancies. I know how much time I spent with my OBGYN, throughout both of my pregnancies. I had a miscarriage as well, having to go through that process too with my OBGYN. The amount of time you spend with your OBGYN, I mean, I just don't know if that's possible that 23 doctors can even give the level of care when they're spread so thin.
That's such a great point, and you're right. 23 doctors can't provide that kind of care, and that's why uh, so many local folks in these rural areas rely on midwives. That's why they are getting so much of the care that they need for prenatal matters, for uncomplicated pregnancies,
Mhm.
from PAs, physician assistants, and from other folks who are not OBGYNs, nurse practitioners. So there are a lot of other medical professionals that are able to help support through pregnancy. And what essentially ends up happening is those 23 OBGYNs are getting folks who either can travel to them or need to travel to them. So, where many of us in pregnancy have the sense that we need to go to an OBGYN, that's who will help me through pregnancy, that's who will help deliver my baby. For folks in rural areas, the practitioners they're relying on are from a much larger pool of folks who can help through pregnancy and delivery. But as I said, that is only really workable if you have a very healthy, uncomplicated pregnancy.
Well, and if you have a very uncomplicated delivery, you can
Yes,
have a very
exactly.
uncomplicated pregnancy and still have a surprisingly complicated delivery.
That's exactly right. Which, again goes to how untenable this is.
So, McKay, with Idaho already ranking among the lowest in the nation for OBGYNs, if we look at it per capita, what kind of ripple effects could we potentially foresee when it comes to the broader healthcare system? I'm thinking things like hospital viability, emergency care, as Amber mentioned, recruitment.
Great question. And in our policy forum this afternoon at the College of Idaho, we'll have Brad Turpin speak. He is the CEO of Valor Health. And he will have, I think, a lot more experiential data that he has
Hmm.
seen with regard to the effects that these laws are continuing to have, not just for women who are of age that they can become pregnant, but for other women who need OBGYN services generally, and even beyond that, just general medical services. And I think that you mentioned at the top, Gemma, but generally speaking, there's been a survey that came out with regard to all specialties in Idaho by the American Medical Association of Physicians using US Census data, and it shows that Idaho is dead last. And this is with regard to all physicians, not just OBGYNs, that Idaho is
Hmm.
50th out of 50. So, where Massachusetts, for example, has 486 doctors per 100,000 people, Idaho has 193, less than half doctors per 100,000 people. So, I think that we're going to see ripple effects that are separate and apart from reproductive health in women, and that we're already starting to see them.
Amber, the Idaho Coalition for Safe Healthcare has been sounding the alarm about patient safety as well as physician burnout. Can you give us a sense of what hospitals and clinics are experiencing right now, truly on the ground in the trenches?
Yeah, it's as you would expect. Our clinicians are overworked. They are certainly looking at burnout. Again, medicine for so many of them is a calling, and when they can't care for their patients reasonably, that has a pretty big impact on their longevity in the field. One of the things that we haven't touched on that I think not necessarily reflected in this report about the number of OBGYNs, but our maternal fetal medicine experts, which are the folks who deal with the most complex and complicated pregnancies,
Hmm.
are vital to making sure that we can support women who are pregnant and delivering in this state. At the before the Dobbs decision, we had 9 of those practitioners in this state, and today we have 5.5, and the half is someone who splits their time between Utah and Idaho. So when we look at those really complex pregnancies, that's another place where the workforce has really been decimated.
Mm. So, McKay, given that Idaho doesn't have its own OBGYN residency program, I'm curious about what role like state policy might play, maybe in creative incentives or maybe disincentives for young doctors to not just train here, but stay here.
It was a pretty good article in Idaho Ed News just a week ago talking about some of those policy efforts to attract new physicians into the state. This idea that the state of Idaho will spend somewhere around 10.6 million helping Idaho students attend medical schools as tuition subsidies. We also still have that arrangement with WWAMI, which is that Washington-led medical program that we've had a long 50-plus year partnership with that includes Washington, Wyoming, Alaska, Montana, and Idaho. And you might remember, Gemma, last legislative session, that was actually targeted and was
Hmm.
vulnerable with legislators threatening to reduce Idaho's involvement in that program. That ultimately did not come to pass, but that's the kind of policy initiative that exacerbates the problem that we're talking about today. You may have heard about some other collaborations with the University of Utah and other areas to try to attract students to go to medical school and then stay in Idaho post graduation. So there are some things in the pipeline that are positive. But I don't know how quickly they'll be able to stall or reverse this trend.
So, Amber, this is not just a women's health issue. I mean, this is truly a community health issue. You mentioned earlier in our conversation about an OBGYN in Sandpoint who decided to leave the state along with her husband, who is an ER doctor. Can you maybe elaborate a little bit more on how losing OBGYNs actually has a broader healthcare impact across the state?
Sure. So yes, there are a number of practitioners. OBGYNs are not alone in finding their life partners at work. So many of the doctors and other clinicians across our state have partnered. They are married to other healthcare workers. So when we lose, for example, an OBGYN in Sandpoint, her emergency medicine husband goes with her. That is pretty standard across the board. And the other piece that we can speak to here is that when there aren't OBGYNs in a particular area, babies aren't being delivered in a hospital, which has implications for whether they can employ a pediatrician full time, which has
Mm.
implications further on down the pipeline in terms of healthcare. So this isn't just about delivering babies. This is about the whole ecosystem of healthcare. And that's one of the things, again, that has happened in Sandpoint is that they now, people who live in that area have to travel further for pediatric care because once the OB labor and delivery unit was closed down, it has all of these ripple effects. So we can see those across the state and across our healthcare system.
McKay, from your academic and policy lens, what options are available to lawmakers who do want to preserve Idaho's current abortion restrictions, but at the same time, still support a functioning medical workforce in our state? I mean, can those things coexist?
I think they can. I think a number of states can serve as exemplars in this field. I mean, we in Idaho are at the very, very far end of the policy spectrum with regard to this topic. There's all kinds of things that, from a policy perspective, legislators can do, including expanding the exception with regard to allowing an abortion for the health of the female. That's just one tiny little thing that can be done. There's now a lawsuit on that very topic, the Adkins decision, that arguably does so. But it really is and should be the legislature that creates that space so that medical providers here in our state don't feel like they have to call a lawyer in the middle of a procedure with a risky pregnancy, which has happened on a number of occasions. And so that's why we're losing a third of our OBGYNs, because they don't want to have to face jail time for making a decision that is an evidence-based healthcare decision that is a national standard. So yes, Idaho legislators can create a much better place that still disincentivizes and even bans abortions in many instances, but not a near total abortion ban that has so many negative secondary consequences.
And Amber, before I let the two of you go, I would like you to remind us of the policy forum that will be taking place this evening for folks who might be interested. Can you tell us about it, where it will be, what time, who will be there?
Yeah, we're very excited to be able to host this panel out at the College of Idaho from 5:30 to 7:30 this evening. We will be, McKay will be our moderator, which we're very excited about. I will be there. We will have Brad Turpin, who's the CEO at Valor Health in Emmett. We also will be joined by Julie Yamamoto, a former legislator. And we have Dr. Kim Stutzman, who practices and teaches in the state, to speak on the issues. So again, tonight from 5:30 to 7:30 out at College of Idaho.
Well, I want to thank both of you so much for coming in and taking a deeper dive into this issue. We've been speaking with Amber Nelson, Executive Director of the Idaho Coalition for Safe Healthcare, and McKay Cunningham, Graduate Professor and Director of Master of Applied Public Policy at the College of Idaho. As Amber just mentioned, the Idaho Coalition for Safe Healthcare will be hosting a policy forum this evening at the College of Idaho, and it will be focused on the disappearing doctors as well as safe healthcare in our state. You've been listening to Idaho Matters from Boise State Public Radio. I'm Gemma Gaudette.
Stay connected with Boise State Public Radio on Instagram. From breaking news and local stories to behind-the-scenes videos, it's where our community comes together. Follow Boise State Public Radio today.